everyone. I'm Dr. Renee Mehrra, and today my guest is joining me all the way from Vienna, one of the most livable cities in the world, in Austria, and it is Dr. Susheel Saini. He's a medical doctor specializing in pediatrics as well as an Ayurveda practitioner. Welcome, Dr. Saini.
Thanks, Dr. Mehrra, for inviting me for this interview. I'm very honored.
Now tell us, Vienna, Austria has one of the most affordable healthcare systems. It ranks very high in the quality of living index, and there is no shortage of medical doctors. What got you interested in the medical career?
Since my childhood, I was very fond if the ambulance was driving by and there were emergency cases, and I was also a big fan of Doctors Without Borders. So as a child, I wanted to become a doctor, to be a part of Doctors Without Borders. So that was the main reason. Of course, when I studied, I saw that I liked the job, I liked the topic, so I went further, and at the end, I became a doctor.
In Austria, the medical education is highly affordable. So you worked as Doctors Without Borders in the refugee camp in Austria, and you also worked in Ukraine. This was like some years ago. And how was that experience? And you also worked in the ER in the hospital in Germany. How was this time?
Yeah, of course, it's very exciting. It's very exciting for myself to go in such areas and to work as a doctor. But the main focus is to help people there, and especially it was a big dream for me to work for Doctors Without Borders, which came true. And it was very exciting to go in a different country and work there, especially if the situation is not stable. But, the people there were very nice, and it was 2015. Yeah. And also in the refugee camp in 2015, it was stressful. But at the end, it's very important to help the people. And if you see that you can give something back, because, we live in Austria, as you told you, it's a wonderful country. We have everything, so we can give something back that we have. Yeah.
And ER can be a very challenging experience.
Yes, as a pediatric, it can be very challenging, because if there is a little child, he can't tell you what he exactly has, so you have to find it out, and it can be stressful, yeah, and you have to be fast, yeah, and you have to see if it's a real emergency or not. So most of the times it can be very stressful.
Right. And then you decided to go to Rosenberg Institute and learn Ayurveda.
Yes, as my parents come from India, I grew up with Ayurveda, and I was a big fan. And when I was a student, I was very interested in Ayurveda. And, after Doctors Without Borders, I decided also to study Ayurveda, because I think it's a very good healing system, which comes from India and is over than 3,500 to 5,000 years old, and especially for chronic disease, I think it's very effective, because, it's not only to give some patients a medication, it's about lifestyle, about how they eat the food, what they eat, and it goes beyond only than a small medication.
Right. So how many years were you there in the Rosenberg Institute?
I'm still studying. As an Ayurvedic doctor or as a Western medicine doctor, you have to study your whole life. So it goes on, The process of studying is a process which goes all my life. So there's no stopping. But I started 2016, yeah, and it was 5 to 6 years, yeah.
Now you have integrated Ayurveda in your practice.
Yes, we have founded a startup which is called Ayurveda Doc, and we went online 4 days ago. Yeah, it's our homepage is called ayurvedadoc.com, And it's based on online medicine. So we are helping people who maybe cannot walk to a practice or to a clinic. They fill a questionnaire, which is very exactly about their diseases and then their problems. They send it back to us. After that, I have a plan. I make a therapy plan, which I discuss with the people on an online consultation. And after that, they get a very individual therapy plan.
Mm-hmm.
To combine Western medicine with Ayurveda, because I think both medicine has their benefits. So if we can take the best of two worlds, we can provide the best medicine to the patients.
Absolutely. And with these treatment protocols, what have been the outcomes in your patients?
Yeah, the outcomes are mostly that the eating behavior is not right. I mean, that's clear. If we eat most of the times fast food or something that doesn't suit to our body, that we get sick. And there it begins. We are what we are eating. So that is one thing which is it's not giving such importance in the Western medicine than in the Ayurveda medicine.
Right. And so you have treated people for illnesses like diabetes or cardiovascular.
Yeah, they are coming with several problems with
respiratory
pain.
illnesses.
Yes, with eating disorders, also with some skin diseases. And I mean, they are coming all people with all their diseases. There's no disease, I would say. Of course, I have to be very careful because, some symptoms which should be treated immediately, I can't treat, we are online medicine. So if there's some serious case, I would always, if I see it on the questionnaire, I call the people and say, go immediately to the doctor. So it's mostly for chronic diseases, which I can help the people to have a better body feeling, or maybe they have less pain in their body, through eating, through lifestyle, through some herbs.
Mm-hmm. And you're helping children because you specialize in pediatrics, so you can...
Yes, I'm specialized on children, but Ayurvedic, mainly I'm treating now adults, Okay. And in future, I will see if I can combine pediatrics and Ayurveda. Yeah.
I see. You are giving a lot of talks, not just in Austria, but in Europe, about the benefits of integrating Ayurveda and medical practice.
Yes, because, the Ayurveda is something we can have in our life, in our daily life. It doesn't need to be now I have to do something special. For example, if you wake up more in the morning, you can have a cup of warm water, which is very good for your digestion system, and there starts. So I think Ayurveda is not only a medicine, it's a lifestyle. So I think there are many benefits if we can follow certain rules, especially if somebody has a tendency to certain diseases, some behavior can help this patient to avoid some diseases.
So what advice do you give medical doctors, when you are talking about Ayurveda practice?
Medicine. So there is no such tip or advice for everyone. So that is that is the reason why I like Ayurveda, because you have to go beyond everything. You have to see also what is the mental status of the person, So there's only not your body, but also your state of mind, which is treated by Ayurveda. So it combines.
And that's very important if you're healthy and spiritually,
yeah.
Mentally, physically, also going to be healthy. And you have actually wrote a paper on the benefits of meditation.
Yes, when I was a student. So I'm a big fan of meditation. I think that meditation is a tool which can everyone use everywhere at every time. So we don't need something special. So meditation, there are many studies about the benefits of meditation, that it changes the anatomy also of our brain if we do it regularly. So it is a very good tool to calm down in a daily life. For example, if we don't take a shower for a few days, we start to stink. So that's the same in our brain. If we don't clean our brain, it's too much. Stress starts, depression starts, and we feel tired, dizzy, and maybe depressed. So I think meditation is a free tool for everyone, which can be used by everyone, and should be given more importance also in Western medicine.
It's a free tool, and it's a very powerful tool.
Of course,
we can all use, and for our daily life, because we've going through so much of anxiety and so much of challenging times, especially during the pandemic. And meditation becomes a very strong adjunct therapy. That
it's some advice I give, to the patients, because meditation, you have to do it yourself. So I can't force anybody. If there would be a friend that would.
Do you recommend?
I recommend that people do meditation, because in the state of meditation, you calm your mind and your body also, and then there's a reaction, which is given through hormones also. If we don't go to the spiritual way, also to the anatomy way and science way, and it calms you down, and you become, more calm, and you are less stressed than before. So that is a huge tool which we can use every day. So, and we should use it every day, because if we also meditate for 5 minutes once a week, it won't help us. It's also, if you go to the gym, if you train 5 minutes per week, you won't see any changes in the mirror. But if you go regularly every day, you can see some changes also in your body. And it's the same in meditation, you have to do it regularly. So for mine, there is in science, there's told that if you meditate from 20 to 30 minutes per day, there are changes in your mind and also in your body.
Do you practice meditation as well?
Yes, I try to meditate twice a day, 2 times a day. So in the morning after I wake up, and before sleeping. So if I have a stressful day, it helps me to come down and to get my inner peace. Right. Especially if you work in an emergency room, you have a lot of stress.
Absolutely. You got to reset your balance right there.
Yeah.
And coming back to Ayurveda, you've seen a lot of success with your patients as well. Where do you want to take your Ayurveda practice in the next 5 years?
We started online medicine, so that was of course of the coronavirus pandemic. So it's easier to give consultations online. So also it's now allowed in Austria to give online consultations. Before the pandemic, it wasn't allowed. So I want just to give that the people have a choice also to get some other ideas, other ways of healing, because there are many ways, and why we are not taking the best of everything and giving it to the patient, right? So that is my idea. So in the future, of course, I want also to have a clinic where I can have patients who can come there, and giving my parents are very good cooks, and we have given before that cooking lessons, Ayurvedic cooking lessons, so that people can also learn to cook Ayurvedic food according to their diseases, to their individual habits. So that is also very important, because many people, if I tell them eat healthy, they are asking me, okay, doctor, what should I eat now? So that is also very important to give them a course or cooking lessons, that they have the ability to cook for themselves.
Right. And has it been well received, all these fantastic ideas like cooking lessons?
Yeah, we have done it in 2016. We gave many cooking lessons, and also we did Ayurvedic branches, and I was very surprised, because at that time I wasn't in social media or something like that, and they were all booked out, So the people were very interested, and until now the people are asking me when is the next cooking lessons, because I do it with my parents. They had 2 restaurants, and it was very easy then to give cooking lessons because we had the opportunity, the kitchen and everything.
Maybe our next conversation should be on cooking lessons as we go through
Sure.
the principles, you know.
Yes, yeah. So you see, Ayurvedic is not only giving herbs. There are many different areas which include the health system. You know, the traditional health system. It's about food. It's about mental state of the patient. So there are many things you can work on. You know.
Yeah.
And that makes Ayurveda very effective.
And it's lifestyle management. It's all about, you know, our daily regimen, you know, waking up at the right time, sleeping at the right time, eating foods at the right time, and eating wholesome and non-processed foods, you know. So.
Yes. So Ayurveda is, the lifestyle is to avoid diseases. Of course, you can also treat diseases, but the main thing is to have a healthy lifestyle according to your life, according to your doshas, which are very important. Every individual has his own doshas and has tendencies to certain diseases. Yeah,
it's very customized.
Yes.
Depending on your doshas, depending on your body constitution, whether your vata.
It's an individual medicine
of them, you know, so yeah.
Yeah, and we can combine it with Western medicine.
Well, thank you very much, Dr. Susheel Saini, medical doctor and Ayurveda practitioner in Vienna, Austria. And it's ayurvedadoc.com. That's your website. Am I correct?
Yes. We are much on social media, also on Instagram, Ayurveda Doc. So please have a look.
Thank you very much, Dr. Saini.
Dr. Mehrra, thanks a lot. Thanks for the interview.
Thank you. And I'm Dr. Renee Mehrra. Stay healthy, stay positive.